Okay, well, welcome everyone to this first webinar in the How You and Your Research Can Make a Difference webinar series that we've been devising. Just a few bits of, well, first of all, my name's Claire Thomas. I'm a member of the Knowledge Mobilisation team at the HPRU for Behavioural Science and Evaluation. And a few bits of housekeeping before we move on to the main content. So first of all, the first part of the session is going to be some presentations from my lovely colleagues that you can see on your screens. So for this part of the presentation, if you can keep yourself muted and your cameras off, that would be appreciated. If you have any questions that you think of as we're going through the slides, please add them into the chat box, and there'll be time at the end of the session, hopefully, for some questions and answers to be done. So pop them in there and we'll pick them up at the end of the session. And also we are planning to record the session. I'm hoping that's already happening. In order that we might be able to, that we will share it on our website in the future for people to check in on again or to share with other colleagues. So hopefully that's all going fine. So I would like to pass over then to Leslie for the first part of our talk.
Brilliant. Thank you, Claire. Really warm welcome to everybody. As Claire has said, this is the first webinar that we're doing, and so we ask your indulgence if we have some technological difficulties, but we're really excited about this and about having you all come along. So as Claire said, my name is Leslie Y. Oops, I still want to go on the first one.
Sorry.
So this is a demonstration of the first technical problem. Right, so I am the lead for knowledge mobilization for the HPRU in Behavioural Science and Evaluation. I have been a knowledge mobilizer for about 7 years. I started off with the NIHR as an NIHR Knowledge Mobilization Research Fellow, and along with part of the Knowledge Mobilization Alliance, which has the purpose of increasing the capacity and capability of knowledge mobilization across health and social care. And before that, well, as part of that, I've also been a researcher since 1992, Bristol Medical School for 15 years and various other places. So I come at this very much from a researcher's perspective, as well as a knowledge mobilizer's perspective. And you can see that our strap line is "You make the difference." And one of the things I've really learned as a researcher is that researchers really can make a difference. We just need to learn how. And a major aim of this series is to start helping people develop the skills and the confidence so you feel as a researcher, whether you're in public health or you're in the university, you feel that you can make a difference. Next slide, Claire. Thank you. So, research does not speak for itself. It would be really nice if the way the world worked would be that we as researchers would publish our scientific papers after we finish our studies. They would go out into the world, and that policymakers, practitioners, service users would be able to access these papers and then act on them in their lives and in their work and so forth. That does not happen. That linear model does not work. And it's the premise of a lot of research production in this country, but there's decades of research into implementation science that demonstrates that that's not how it actually happens. It's not research speaking for itself, it's researchers speaking for research that make the difference. Van der Ven talks about two different kinds of knowledge. He talks about knowledge that's from scholarship and research, scientific knowledge. And he talks about the knowledge of practical knowledge, knowledge of how to do things. So we as researchers are very good at sharing scientific knowledge with each other. but we have less success in reaching out to those with practical knowledge. So one of the things that's really interesting about this is when I was a researcher, I spent a lot of time hanging around healthcare commissioners and looking at where they got their information from and what they did with it. And what I found was that apart from nice guidance, which they would look at, but often could not implement because they didn't have enough money, or the occasional evidence review from a public health consultant, research really, really didn't inform their decision making. And that's what I really want to change in terms of knowledge mobilization. I want research to influence the decision making of policymakers, practitioners, and service users. And we're beginning to see some examples of that happening now, which is interesting in the COVID era, in that you have SAGE. And what's happened there is, I'm sure many of you know, is it's not that scientists on SAGE are handing across a whole bunch of papers to policymakers and ministers and civil servants and saying to them, now you get on with it. What they're doing is they're having lots and lots of conversations. They're having conversations in public meetings. They're having conversations in one-to-one. They're having lots of conversations. And that's how they're influencing decision-making. And this is because they have access to the research. They get to understand it through hearing from researchers. And they then can decide how and if they want to apply it. So you need that access, understanding, and before you get application. Right, Claire, can we go on to the next one?
Yeah.
So these are the 3 key questions that, in terms of thinking about knowledge mobilization and comms, are really, really helpful. And in terms of knowledge mobilization, it's really good to start thinking about it from the very beginning. So what I'm talking about is, for example, you have an idea, you want to do some research in terms of dementia in hospitals. That's the point at which you start asking yourself these questions in terms of knowledge mobilization. So the questions are, what do you want to be different because of your research? Who are the people who can make this happen, and how can you engage them? And how can you and they help make it happen? Next slide. So knowledge mobilization, in terms of definitions, knowledge mobilization is all about transformation. We want something to be different in terms of behavior, in terms of policy, in terms of practice, because of knowledge mobilization. So the definition is about bringing different communities together to share knowledge, to catalyze change. And the kind of knowledge that I was mentioning before, scientific knowledge, practical knowledge of how to do things, experience of services, all sorts of different knowledge can be combined together and is necessary to create change. If you don't have that, if you don't have knowledge mobilization, you get limited impact. I mean, occasionally there is a fluke in which somebody publishes a scientific paper and change happens, but that's pretty rare. What you need is the focus on transformation, interactions, conversations, and relationships building. It's incremental. It happens over a period of time. And there's all sorts of activities that can be involved in terms of knowledge mobilization. So networking, meetings, workshops, training, trying things out in terms of piloting interventions, embedding new procedures, creative arts, theater, Lego. People do all sorts of really interesting things in terms of helping people from different communities to share their knowledge to catalyze change. Now I'm going to hand over to Helen, and she's going to talk a little bit about comms. So next slide, please.
Thanks, Leslie. So I'm Helen Bolton, and I'm the Communications Officer at the HPRU in Behavioural Science and Evaluation at the University of Bristol, where I work 1 day a week. And I also work 3 days a week for the Centre for Academic Primary Care at the University of Bristol. So I'd like to start by just looking at these 3 questions again that Leslie's been talking about, because as Leslie said, these 3 questions are just as relevant for comms as they are for KM. They are, if you like, the motivators for embarking upon both KM and comms, and the sort of the same ground from which KM and comms activity emerges. And I'll say a bit more in a minute about how that works for comms. So next slide, Claire, please. Yeah, so as Leslie said, KM is concerned with or takes the path of transformation. Comms, on the other hand, is concerned with or takes the path of transmission. So this is a little bit simplified, but we think it's a helpful way of distinguishing between the two. So comms really is about spreading or raising awareness, achieving widespread reach, and using mass media methods to do this. And the main goal of comms is to get your key messages out to your target audiences in a way that aligns with the goals of your research and a way that's meaningful and accessible to the people that you're trying to reach. And there's quite a lot sort of packed into that sentence, but it's important in terms of setting you on the right track of, you know, identifying who your audiences are, tailoring the messages for those audiences, choosing the right media to reach them, and packaging the content, if you like, in a way that's going to land well with them or sort of be easily digested by them. So just going back to the what, the who, and the how of the three questions for a minute. For comms, you need to make sure that the messages you're creating are ones that are going to move people in the direction of the new understanding that you want them to have on the back of your research, and that will ultimately lead to the change that you want to happen. So that's the what. You also need to make sure that you're reaching the right people and you're using the channels and the content that will engage them long enough so that they can receive your message. So that's the who. And you need to create messages that are inclusive. So that is, present them in a way that your target audiences can see how your idea works for them. And ideally will lead them to want to share it with others and potentially also come back and engage with you. And social media is a great way of provides great opportunities for that feedback loop. And it's worth remembering that you might need to use, and in fact you almost certainly will need to use, more than one channel to achieve widespread reach. So one person might get your research message from an article in a specialist health publication, another might get it from a tweet, another might get it from reading a news story in a local press, or somebody else might get it from somebody, a colleague forwarding a newsletter, your newsletter, with a note to say, read this. And it's also worth remembering that sort of one of the special things about comms is that your messages are going to be transmitted through a range of media, and therefore they're going to be mediated. And you won't always have control or full control over that process. So for example, if a journalist is delivering your message for you, so you need to think about not only the end user and how they might receive your message, but also you need to think about the specific requirements or conventions of the media that you're using. So for example, you know, when you're writing a press release and so on, using the conventions that will work for that. Sorry. Yeah. And I think the advice really here is to make use of people who've got the sort of knowledge and expertise and skill to help you do that. So thinking about your press officers, communications and marketing colleagues, specialists, social media experts, and designers. Particularly when it comes to thinking about, you know, what makes this news so that you will actually make it to that sort of media outlet with your message. And I'm going to be doing a separate session in March on working with press office and media, so would go into that in a bit more depth. And then finally, just a word on timeliness. So an idea might be before its time or after its time. I mean, ideally, it's going to be right on time, but that doesn't always happen. So if you miss the boat for any reason, or you arrive too early for the departure of the boat, don't fret. keep your eye out for opportunities and be ready to communicate your message when the time is right. And there are a number of things you can do. You can join your university's database of experts and make yourself available for comment when your idea has the best opportunity of being listened to or taken up. And that goes for things like offering to write articles or taking part in Twitter conversations. Keep your eye out for the opportunities. Okay, that's it from me.
Right, so this is a table that we're very proud of. This table. It took us quite a long time to to figure out how knowledge mobilization and communications, how they were similar and how they were different. This is a table that all of you should have received, so we're not really expecting you to go through it now. And we probably are over-laboring the difference between knowledge mobilization and comms because they can work really well together. There's quite a synergy. So for example, something that Helen was just talking about, you can send out press releases and social media with your messages, and then somebody gets in touch with you and you start having conversations and you start to develop an ongoing working relationship with them. The first is comms. The second, with the relationship building, is knowledge mobilization. And it can work the other way too, that you can get together a group of service users, for example, to talk about the research and what you want to have come out of the research. And then, and this is a real life example, and then come up with some posters and infographics and so forth, and that would be more in the comms box. But we've separated them out for you because people often get the two of them confused. And sometimes there's a feeling that if you send out something on social media, that will be enough to make change happen, or that conversely, that if you start having conversations with people, that will be enough for them to get a clear understanding of your messages. So the two of them can work together really well. Helen, have you got anything else to say about that table?
Yeah, just a couple of things to add. So just to say that, you know, KM and comms are not an either or, let's say that. But you can choose to prioritize your efforts, you know, depending on what you were trying to achieve at a particular point in time, maybe at a particular point in your project. And the other thing I would say is around reputation building. So comms can help you get known as an expert in your field. And that can be really useful when you're approaching people to try to get things done. So on the KM end of things. So I think that's just another example of how they really kind of work well together. I mean, people will Google you and they will look for you on Twitter. So I think if you think about comms as also helping you build your reputation, it's useful.
Next slide, please, Claire. Okay, fantastic. So Hannah, there's the Hannah. So what we thought would be really helpful. Oh, okay, there's the real Hannah. I didn't expect all the slides to go away. Okay, so what we thought would be really helpful would be to talk a bit to Hannah, because Hannah has experienced recently both working with the KM team at the HPRU and with comms with Helen too on a particular project. So, and she very graciously, very kindly agreed to come talk to us all. So Hannah, you tell us a little bit, first of all, about what exactly was the project that you were doing?
Yeah, sure. Thanks, Leslie. So yeah, I'm Hannah Christensen. I'm a senior lecturer based at the HPRU in Bristol and the academic development lead here as well. And what we did over the summer was a rapid review of mathematical modelling studies, considering how COVID might impact staff and students within a university setting. So I'm an infectious disease modeller. This is my area. And we were doing this when universities were trying to plan what their mitigation measures would be for the students returning in the autumn. So we started it in about March. And we were looking to gain some insight from these mathematical models that had been done already, that what might work best for UK institutions, but maybe particularly Bristol, as we start to welcome our staff and students back. And we found 5 papers from this review. They were all preprint papers, but we did find some consistent messages coming from them. So what we found from this review is that there was considerable risk of COVID spreading really rapidly in a university setting with highest case numbers in students. In terms of things that could potentially work, testing of symptomatic people, screening of people without symptoms, and isolating cases was really critical if you wanted to contain the spread of COVID, if you did nothing else in terms of mitigation measures. If you didn't want to go so much down the testing route, then other mitigation measures could be really effective. So things like moving teaching online, social distancing of students and staff, and the use of face coverings by everyone really was really useful, could really reduce the number of cases. And if you did that, you didn't really need to screen mass testing, mass screening of people. But the critical thing really overall, I guess, for us as our takeaway message was that multiple interventions were needed for control. And there was likely to be really big implications in terms of supporting students who might be isolating because they either had symptoms or because they'd been through this sort of test, trace and isolate route. So those are the key things that we were finding out of this review.
Okay, great. And probably useful to mention that this review was coming out in August, wasn't it? So it was just before the students were all coming back.
Yeah, exactly. So we completed the review in August. I think we got the preprint paper posted on medRxiv on the 9th of September. So we were sort of planning these, finding these initial findings in early August, really.
Great. Okay, so what did you want to be different because of your research?
So the critical thing for us was that we really wanted our results to inform the decisions being taken, both within Bristol University, our home institution, but also for the sector as a whole, for the mitigation measures for the autumn. Everything's happening at such a pace at the moment, but we had this review, we had some evidence that could be useful for planning, so we really wanted people to be able to use it. And we really felt that there was a need for urgency. I must admit, I guess my usual approach is, I do the research, I put a paper out, I've worked with the comms teams before, I guess a normal standard academic route for most of us. But that was just going to be too slow in this instance because we had these results in early August. Our students were coming back late September, early October. We needed to get these messages out really. So we needed to do something a bit different in this instance.
Okay, great. So who did you need to engage with and how did you do it? And you might want to think about in terms of comms and KM if there was any difference.
Yeah, sure. So, I've worked with Helen, our comms teams previously. I guess I'm more familiar with that route. I hadn't done any knowledge mobilization before, or if I had, I hadn't really thought of it as that. But we have Leslie and Helen now at our HPRU. So I reached out to them early because I knew we had this resource within our HPRU here. So from the comms side, we talked, Helen and I talked about creating a press release and how that might work. So we're sort of thinking about the press teams within the Bristol as well as Helen herself. And when I reached out to Leslie, we had a bit of a chat about how this could actually work for this paper and who we might want to contact. So we particularly wanted to access policymakers within the university. We particularly wanted to get messages out to our students and students' representatives. So those are the two sides really, I guess, in terms of people we were trying to reach.
Yeah, and it was interesting, wasn't it, too, because there was this about communicating with masses of universities across the country, but also within Bristol in terms of the KM, wasn't it? So there was sort of that balance between the two. So you mentioned some of the things that you did in terms of the comms with a press release and so forth. What else did you do?
So I guess to talk about the comms a bit more. So we did, Helen and I worked to create this press release that went out, and Helen also made this really great video to accompany that. So that went on Twitter, across our HPRU Twitter, and it was also shared with the student representatives, so that could go through the student channels to share it with the student body. It was a very accessible video, it's really short, with the key messages on, which is really nice. In terms of the knowledge mobilization, I ended up having, well, because of Leslie's sort of network and suggestions, really, I ended up having a lot of video calls or conversations with different people. So we spoke to the Pro Vice Chancellor, did a video call with her to kind of explain our findings, see whether that could influence what they were doing, sort of a top-down approach in terms of policy. We also reached out and I had a conversation with our student voice manager, and then she cascaded our work onto, we have 7 sabbatical officers here for our undergraduate and postgraduate students. So they sort of fed down into the planning and the sort of messages that were going out to our students at the start of term. And that ended up being quite iterative, actually. So we had an initial conversation. She came back with further questions, asked if she could share it, pass it on. So it ended up being sort of conversations sort of over email and actual telephone conversations over a couple of weeks, really trying to get different messages out so they could sort of understand a little bit more about what we were saying. So those are the sort of 2 activities, really. Lots of conversations with different people, and then the press release and the video for the comms side.
And you were also having conversations with Caroline Relton, weren't you? Who was also in turn having conversations with people at SAGE and so forth, wasn't it? So there was lots.
Yeah, there was a lot going on.
There was a lot. It was a very busy time, wasn't it? We were very tired. Okay. So what are you now, having had that experience, what are you doing differently as a researcher, having now worked with the comms and the KM team on that particular project?
A few things, I guess. So I think a little bit differently now about the audiences when I'm planning. So I think I've tended to sort of reach out to comms quite late, actually, being honest about it in terms of the course of my research. And I would definitely start earlier now, definitely start with the kind of, oh, I've got this idea, or I'm just starting this piece of work. I would definitely reach out to comms and KM a lot earlier. So think about the different audiences. And I think particularly talking with you, Leslie, about, okay, well, who do we need to talk about here? It's not just policymakers. We need to think about students. We need to think about students in Bristol and further afield. It's sort of different levels of impact, I guess. You might be thinking about much more earlier than I would have done before. I guess I'm talking about KM and comms to people. So I've mentioned it now. I guess I've had quite a good experience for this one. I feel like it's gone quite well. I feel like the messages have actually got to the people they needed to get to in a really short space of time. So I'm encouraging others to try it as well now, more than I might have done before. So those 3 mostly, I think. I would definitely do more KM in the future than I've done before. The comms is I guess a more traditional for me, although again, there's different elements of that, but working the 2 together, KM and comms, I think can work really well.
Brilliant, thank you so much. And I was just saying, I was interrupting you, sorry about that, but I was going to say you've become a KM champion. We've noticed from the KM team, the things are coming via Hannah. Last thing, any advice for people here who are listening?
I guess give it a go, really. I mean, I think most of the people who are on this call, maybe coming through HPRUs, you'll all have a KM lead, you'll all have a comms lead within your HPRU. So those might be easy access points. I guess if anyone's on the call that isn't, there'll probably still be someone who you can find within your network and organisation that has a sort of KM role if you need a little bit of support. I think it's worth just giving it a go and seeing how much difference it can make to the impact that you're having, really.